pathogenesis and prognosis of type 1 diabetes. In spite of the truth that prolonged behavior alteration generally is required, a first model seen increases the potential that even transient alterations may become steps in the right orientation, assisting us to grasp the obstacles at various phases and elevating the possibility of subsequent behavior alteration trials. Accurate prognosis of after-time diabetes in healthy kids stays an essential target for kind 1 diabetes prohibition. Anyway, the magnitude of the rise in happening of kind 1 diabetes is higher in younger kids than in older kids. The rise began 2 decades previously for little boys than for little girls and appears to be persisting, especially in little girls. The seasonal manner of being of diabetes model in boys diverges only regarding to age. Awareness concerning the epidemiology of kind 1 diabetes mellitus has constantly become of attention amongst diabetologists. The natural history and etiology of kind 1 diabetes mellitus, insulin dependent, are still not recognized, but both environmental and genetics agents participate to the improvement of the ailment. However, epidemiological information is essential not merely for health patronage frameworks, but also for research workers, giving worthy data concerning the implied techniques of this chronic ailment. Admission of the notion that phases exist also has suggestions for theory improvement. If agents that ease motion toward action differ from phase to phase, few, if any, agents will be essential at all phases. In fact, the mechanisms are perhaps more complicated, as there are situations of kind 1 diabetes mellitus where insulin impedance probably performs an essential function. The genetic agents have been presented to be essential in the tendency to kind 1 diabetes. In common, kind 1 diabetes is believed mainly a T-cell mediated ailment, and overall proof subsists in both mouse and man to advocate this. What's more, kind 1 diabetes is depicted by selective lack of insulin manufacturing beta cells inside the islets of pancreas in genetically liable subjects. Recognition of genes inducing to kind 1 diabetes mellitus will elevate on perception of the genetical pathogenesis of kind 1 diabetes mellitus and participate to the evolution of novel prohibition and treating of kind 1 diabetes mellitus in the aftertime. Inspection of islet tissue obtained from pancreatic biopsy of patients who have modern beginning kind 1 diabetes asserts insulinity, with the existence of an infiltrate constituted of macrophages, beta lymphocytes, and CD4 and CD8 T lymphocyte, proposing that these cells own a function in devastation of the beta cells. Anyway, the most essential genes participating to ailment susceptibility are placed in the locus of HLA class II on the shortened arm of chromosome 6. Early prevention treatment may be more efficient in the pathogenesis due to some or all of the following agents. 1. Less clonal extension of cytotoxic effector populations generating in less cells to prevent. 2. Lower inter and intramolecular antigen expanding conducting in a less various immune reply to disconnect. 3. Beta cells not being compressed to utmost insulin product where they may become more liable to immune elimination. 4. A greater ratio of non-inflamed islets which may run away immune infiltration next to treatment. And 5. At most beta cell replication neogenesis in the non-attendance of inflammation and hyperglycemia. These theoretical benefits may generate an early efficiency for contained treatments incapable to reverse the diabetes when offered after diagnosis. The precaution adoption process model, anyway, presents that other matters essential to behavior alteration arise before commune ever believe strongly concerning action, and still various issues emerge after commune have decided to perform.